What is going on, fam? Thank you very much for tuning in. In this video, we're going to be talking about antidepressants and why you should avoid them, in my opinion. Now, as I said before, I am not a clinician, but I'm prefacing this video as that this is based on my opinion and given in the sense that I'm trying to watch out for you. There's not a lot of people talking about medication and mental health, and so I'm just trying to be an advocate for you why you shouldn't automatically go and get some sort of Xanax or antidepressant because you're going through mental turmoil right now. Just to give you an idea of what inspired me to create this avoid these antidepressants, in my opinion, was I was reading this men's health article, and it's called The Anxiety Trap. Now, the anxiety trap, I'm just going to give you a glimpse. It says, as more patients seek treatment for anxiety, more doctors are prescribing pills, but what happens when a short-term fix becomes a long-term problem? I've been working in the mental health industry for about 22 months now. In June, I would have been working for a mental health clinic with psychologists, marriage and family therapists, and licensed professional counselors. We treat, on a spectrum, depression, anxiety, borderline personality disorder, bipolar disorder. We also test for stuff like dementia and Alzheimer's and all this stuff. So I know quite a bit more than the average person about mental health. Now, is this going to say I don't need to get a license? That's not what I'm trying to say. I'm just saying, as somebody who's a normal person who knows so much about it, operations side, and then asking questions not only with my mental health, but with the mental health of others and how therapists need therapists. There's a lot that goes on into this. But the reason is because the anxiety trap. As you already know, I have 3 anxiety disorders: generalized anxiety, a panic disorder, and then post-traumatic stress disorder. Now, I do have social anxiety, but that's just also based on my personality. So if we have to say that's 4 anxiety disorders, that's not including the fact that when I asked my PCP, my family nurse practitioner, for help with my anxiety, I told him I don't want to be addicted to Xanax. And then he gave me an antidepressant, an SNRI, to help with anxiety. Truth be told, little behold, in the light of things, it turns out at the time that I was taking that, I was undiagnosed bipolar, going through a hypomanic manic episode, and that only made things worse. Given if I would have said, hey, why don't you just give me ADD medication and I'll be okay? He says, I can't do that. You need to do an evaluation, but we can help with the anxiety. He gave me the wrong anxiety medication, and I ended up being manic. So that is primarily why. I started hallucinating. I started going into delusions. I started getting paranoid. So as I tell you this, I don't want you to rely on your PCP, not to say that they're not beneficial, for anxiety and depression medication. I really want you to get the mental health help you need. With this anxiety trap, there was something that came to light of me on the anxiety spectrum. Now, the anxiety spectrum is situational anxiety, mild anxiety, moderate anxiety, and severe anxiety. I am on the severe anxiety. So there's a part where it says that if you have situational anxiety, kind of like you're about to do a big speech, to take a beta blocker. Something like propranolol. Now, this is propranolol. It's a blood pressure medication. That's what this is saying, to take a beta blocker. Propranolol, that's one of the ones that I use. To lower your blood pressure, you sweating and all this stuff and feeling panicking, that kind of stuff. I could say I agree with that. But when it comes to the mild anxiety and it comes to the moderate anxiety, this is what I don't agree with. With mild anxiety, like racing thoughts, heart palpitations, excessive worrying, it is saying to try to get cognitive behavioral therapy and then consider yoga. Definitely. Yoga, stretch, meditation, even if it's at work, definitely do that. But when it gets to the moderate anxiety, it says practice cognitive behavioral therapy, which I kind of do. And mindfulness meditation, that's what I do more. But it says to talk to a psychiatrist about an SSRI, such as Celexa, Zoloft, or Prozac, or an SNRI like Cymbalta. Now, on the moderate severe anxiety side, it is saying to take an antidepressant. I am telling you to avoid these antidepressants, in my opinion. The antidepressants, again, is a spectrum, but people have used antidepressants off-label to treat anxiety. I don't think you should do that. I think you should actually just get into therapy and take something like a beta blocker, practice mindfulness-based yoga techniques, everything else other than go straight for an antidepressant. Like, I don't agree with that, in my opinion. The reason is because the 4 antidepressants that you shouldn't take, which is really hard to state unless you get a psychological evaluation done, if you're undiagnosed bipolar, is MAOIs, tricyclics, SNRIs, and SSRIs. Most of them. I take an SSRI, but it's not an exclusive SSRI. It's an SARI, an antidepressant known as trazodone, or I think it's Disaril, something like that, brand name. The reason why I take that particular antidepressant is as a sedation technique. So with 75 milligrams, supposed to treat depression. 75 milligrams trazodone is to treat mild depression. That's the theory, right? I'm taking about 50 to 75 per night, but I only take it because I use it to go to sleep. I don't go past 75 because I'm not depressed. Now, if I was mixed manic and depressed, I would see that more happening because I'm treating depression. And then, of course, I'm taking Buspar, which is actually a really good anxiety medication that I take. I think you should ask about it. Along with my situational and panic attacks, I also have to take either Seroquel, quetiapine, my mood stabilizer, if I'm going through hypomanic panic disorder, mood instability, that kind of stuff, and then anxiety, situational panic attack, just not too severe like that, I would take a propranolol. So again, there is so much that goes into getting mental health services. If you're getting mental help and it's because you're going through a really tough time, I would say to avoid antidepressants, because if you are undiagnosed bipolar and you're going through a tremendous amount of anxiety and depression at the same time, if you take an antidepressant, in theory, you may induce yourself into a manic state like I did and almost admit yourself into a psychiatric hospital. I don't want that for you, because for my particular specifier, I was depressed and anxious at the same time. Like, imagine that. It's like a seesaw and you can never balance it out. So if we take an SSRI, right, a manic, to make me feel good, that's more mania, but I'm still depressed because it's not treating the depression. I feel too good. So that is essentially my take on you getting the proper mental health help you need. I do like the anxiety spectrum. I disagree with the moderate and severe anxiety, stating that you should try SSRIs or SNRIs. I think you should definitely get the behavioral health therapy you need. You should also see about meditation, yoga, possibly acupuncture. Try to take a self-care day out of the week, but I do not believe, in my opinion, that you should go straight to an antidepressant to treat anxiety and depression itself. Because if you're undiagnosed bipolar like I did, I will repeat it to the day I die, you're gonna end up in a bad situation. But that's just my 2 cents. I've said my piece. That's it. I'm done. If you have any questions, comments, concerns, make sure you hit me up in the comments section. Also, don't forget to share this video if you like it. And before you go, make sure you like and subscribe. Follow me, because how the hell else are you going to stay updated? And make sure you follow me on Facebook, Twitter, Instagram. I am now on Tumblr, Pinterest, LinkedIn, and TikTok. Until next time, guys, stay tuned. Take care.